Hi, I am Nelum. Welcome back to my YouTube channel. Today's video is about tuberculosis study guide. This video contains what to refer to study tuberculosis, must know stuff, and few study tips to boost your memory. So what to refer? There are actually three main guidelines you should refer. First one is National TB Guideline. The latest one is from 2016, and there's EPTB guideline, that is extrapulmonary TB guideline, and there's another one, the latent TB guideline. So here National TB guideline and the EPTB guidelines are very important. All the facts you need to know for the exam are contained in these two guidelines. Considering the latent TB guideline, it's actually on the way of a process to launch it, so it's not available there at the moment. So I don't think it's really needed for the exam purpose. But National TB guideline and the EPTB guideline you should refer to study tuberculosis for the selection exam of DTCD in 2021. Here's a picture of National TB guideline. It's also called National Manual for Tuberculosis Control. This is a very informative guideline. It has altogether it has 22 chapters, but for the selection exam for DTCD, I think first 12 chapters are the ones that are more important. So here I have included a picture, and it contains up to 12th chapter there. It's the epidemiology of TB in Sri Lanka. So up to this chapter, I think you should study for the selection exam. Must know stuff for the to study TB. You should know tuberculosis in detail, because this diploma is mainly on tuberculosis and chest diseases. One whole part is for tuberculosis, so you should know TB in detail. First of all, you should know what is TB, and then you should know what is primary TB, and then you should know post-primary TB, and then more importantly pulmonary TB. In these three subtopics, what you should know is the causative organism and how it is caused, and the immunology, and likewise the clinical symptoms, and all those things you should know. Consider the extrapulmonary TB. I think you already know TB bacilli can infect any body part except for hair and nail. So extrapulmonary TB can occur anywhere. So there's plenty to study, but out of that I think TB lymphadenopathy, TB pleural effusion, and CNS TB are the most important topics that you should study for the selection exam. So in these topics you should know in detail, so you can refer the National TB guideline. All the information that you should know about these topics are clearly mentioned in the guideline. You can read and you can cross check with the MCQs, and you can boost your memory. So likewise you have to study, and then there are some other topics that you should study along with the clinical scenarios of TB. Those are sputum analysis. So in here you should study about Ziehl-Neelsen stain, and then you should also study Oramin stain, and importantly you should study about gene expert, and then you should study about liquid and solid culture methods. And here of course it's really good if you can study about culture media as well, because then and there they ask some MCQs about culture media as well and its contents. And then you should know about line probe assay, Mantoux test, and BCG. All these subtopics are also mentioned clearly in the guideline. When you go through it, you will find very informative chapters about these subtopics in the guidelines. So I ask you to refer that and read that to face your exam in next year. So then you should study a bit more about pathophysiology of TB, and importantly about granuloma. So I have included a picture here to help you. So pulmonary tuberculosis I have mentioned here. So it's it's an airborne disease caused by Mycobacterium tuberculosis bacteria. So first it affects the lung, and then it disseminates to blood, and then to lymph nodes, and likewise the dissemination happens, and you have to read around it, and you have to be thorough about pathophysiology of TB for the selection exam. And then you should know the structure of the granuloma. So in TB there's caseous necrosis, and in the center there's caseous necrosis. In the granuloma there are two rims. First rim is composed of epithelioid cells, and the second rim is composed of lymphocytes along with Langerhans cell type cells and multinucleated giant cells. This structure you should know, and the pathophysiology also you should know. These will be there in MCQ stems, and I suggest you to read about these two topics. If you can refer a pathology book, I think it's good. And the hypersensitivity reaction of tuberculosis, if you can read, I think that's also will benefit you. So then let's move to extrapulmonary TB. There's a whole guideline for extrapulmonary TB. It's actually a very lengthy one. Actually you will not be able to read it and finish it, so I suggest at least to read about TB lymphadenopathy, pleural effusion, or bone TB and CNS TB in that guideline. It's also very informative, and all the information you need to know are mentioned there, so you can refer this guideline and you can get ready for your selection exam. And then importantly you should know about anti-TB drugs. Always there are some MCQs on these drugs. So I have given a picture here. This I have taken from the national guideline. So there are first line drugs and second line drugs for TB. Most important drugs are mentioned here. Those are isoniazid, rifampicin, streptomycin, ethambutol and pyrazinamide. And there's this subbacillary populations in among TB bacilli, and the activity of these drugs differ according to these subbacillary populations. So there are 4 types of subbacillary populations: A, B, C and D. A is extracellular rapidly multiplying bacilli, and B is extracellular intermediately multiplying bacilli, and C is intracellular semi-dormant bacilli, and D are dormant bacilli. So activity of anti-TB drugs differ, and you should know this picture, which drug affects which bacillary group. You should know. This can appear in your MCQ. So I ask you to refer this picture and to get ready. And then you should know about the treatment category, because previously TB treatment categories there was a different division. Initially it was like category 1 and category 2. Now that division is no longer there. Now treatment categories are mentioned as new and retreatment, and the duration of these treatment regimes are also different. New treatment regime is for 6 months and retreatment regime is for 8 months. This is a very easy division. You can refer there. The drug combination is also different, so you can refer and you should read about this, and you can be thorough. And you should know the definition of new treatment category and retreatment category. Don't worry, all the information you need to know about these categories are mentioned clearly in the guideline, so you can refer and study. Then you should know the adverse side effects of these drugs. So it's also mentioned in the guideline very clearly. I have taken this chart from the guideline. So common side effects and rare side effects are there, so you should memorize this chart, and this will help you to mark your MCQs. And then there's another chapter you should read, that's TB in special situations. In there actually TB with HIV, TB with chronic kidney disease, TB with liver disease, TB with pregnancy, you should study in detail. Considering HIV and TB, it's really important because clinical presentation is different than a normal subject. So you should read around that. It's also mentioned in the guideline. However, there's another special guideline for HIV and TB. If you can find that guideline and you can read it, it will be also good. But it's time consuming. So you can choose this chapter in National TB Guideline to read. And then you should you must know about IRIS, that's Immune Reconstitution Syndrome. So there are two types of IRS. So you should refer that two types. It's mentioned in the guideline. And then the INH prophylaxis you should know under this topic, HIV TB. And then this chart you should know the clinical picture with compared to CD4 count, and sputum smear result compared to CD4 count, and chest X-ray features compared to CD4 count. This is also mentioned in the TB guideline, so you can refer this chart as well. And then considering the special situations, TB in CKD and liver disease, what's important here is the drug regimes. So with nephrotoxicity and liver toxicity of anti-TB drugs, there are some instances that we can't use the usual regime. So there are 3 special regimes with alternative combination of drugs for these 2 special situations. It's also mentioned in the guidelines. 3 regimes are there: SHE and HE, REZ and RE, HRER and HR regimes. Likewise, it's there. So you can mention along with the duration of these regimes. And then finally, I think you should know about a little bit on epidemiology of TB as well, and a little bit on National TB Control Program. So in that you should know about incidence, prevalence, dot strategy, that is directly observed therapy short course, and Millennium Development Goals and Sustainable Development Goals. Likewise, there are some goals mentioned in the guideline, so you should refer. I have included a picture here to give you some idea. So dot strategy, Millennium Development Goals, top TB strategy, Sustainable Development Goals, and TB strategy. These few strategies you should know then and there. Some MCQs can contain these topics. Finally, you should know a little bit about MDR-TB, that's multi-drug resistant tuberculosis. So you should know the definition of drug resistance, types of drug resistance. It's also mentioned in the guideline. There's a separate chapter, but you don't need to know much detail on drug regimes because it's getting updated all the time. What's mentioned in the guideline is just a brief guide. It's not the correct regime actually. It's much changed now. It will get updated soon, but you should have a brief idea on drugs which are used in MDR-TB and mainly the types of resistance. Those are monoresistance, polyresistance, rifampicin resistance, also called as RR, and multi-drug resistance and extensive drug resistance. There's clear definitions for each of these types of resistance, so you can read it in the guideline. It's mentioned there. And to conclude my presentation, I would like to suggest few study tips because this tuberculosis and its content, what you have to study is very vast, and you will not have enough time to complete all that. But don't worry, you can boost your memory and you can effectively study. That's all what you know. So there are few smart study tips I would like to suggest for all of you to succeed. First one I would like to suggest is the sticky notes. So whenever you have some difficulty in memorizing any topic, what you have to do is you have to simply write it in a sticky note and put it in your wall, and you will see it every day, and that by that you can stick that points in your mind. So when you're doing MCQs, it will come to your mind very quickly. And then you can use flashcards. I think you know what flashcards are. So you can use flashcard to boost your memory. And definitely I think you should make short notes, because these chapters are very long, but reading again and again won't help you, because it will take lot of time. So I suggest you to make short notes on each and every chapter. So ultimately actually you will need only 12 short notes to finish your guideline. So for each chapter I think it's better if you can make a very short note, because most of the paragraphs mentioned in there are not very important to face the MCQs. So just go through a chapter and find what is really important for MCQs and write it down and make a short note, and that will save lot of your time, and you can study very well likewise. And then I always suggest you to use your own mnemonics, and it will help you to get more things clearly into your head, and it will help you to boost your long term as well as short term memory. And there's another study technique called read and recite technique. So in this technique it is advised just to read 20% of time and recite it again 80% of your study time. That will help you to boost your long term memory. And of course you should teach somebody, and you should discuss with others, and that will boost your memory. And kindly find some good study tips, and here I think Pomodoro technique is very effective. I have used it myself and it has helped me a lot. You can just Google it and see what Pomodoro technique is, and then you will see the difference. It's very effective learning method to save your time and to study a lot within a short period of time. So that's all I have to tell you. So these are few pictures of sticky notes, flashcards, and Pomodoro technique. That's all on TB study guide. I think this will help you. Thank you very much. Thank you.